Good afternoon, everyone. My name is Lindsay, and I'm live here at Thrive Wellness and Aesthetics in Catawba, and I'm joined by...
Hello, it's Ashley. Welcome. We're here to tell you about our newest service, which is Bioidentical Hormone Replacement Therapy.
The question for you all is, do you suffer from any of these symptoms? And we're going to list them off here. The first one is fatigue and lack of energy.
Followed by difficulty sleeping.
Reduced mental focus, brain fog, problems with memory, and staying oriented with tasks.
Do you have mood swings, anxiety, depression?
Hot flashes and night sweats.
Stubborn weight gain, the inability to lose weight despite the diet and activity.
Decreased muscle strength.
Muscle and joint pain.
Or reduced sexual desire. If any of these things sound familiar to you, or if any one of these, many times we have clients that come in that say, I can check every single box on that. If you're one of those individuals, we're going to explain to you a little bit more about how our bioidentical hormone therapy replacement could be honestly very life-changing for you in so many ways.
So they're called pellets, and they're actually inserted subcutaneously through a small incision in the upper portion of your buttocks. You come in and we actually draw your labs in-house. We will draw your labs, then we send them out. Once your labs come back to us, which is usually within 48 hours, we are able to implement them into a system, a BioIT system that is going to basically kind of generate to us how much hormone replacement therapy you may need, or how many pellets that you're going to need. Men will get testosterone, and then women, depending on how you answer our questionnaire, you may get testosterone, estrogen, and progesterone, or a combination of all of them, or you may only need testosterone. And then we bring you back 4 to 6 weeks later. We're going to retest your labs once we've pelleted you. And then if you need a little boost, we give you a little boost. And other than that, men get pelleted twice a year, and women are typically 4 times a year.
I just wanted to read off some of the actual quotes that we've had from patients. We've been doing this now for about 3 months. It's been very successful. We've had quite, I think, more than we anticipated as far as those individuals that, again, check all of those boxes and not realizing that there is something indeed that we can do that's extremely helpful in so many situations. So I'm just going to read off a few of the things that we've heard with those patients that have been coming in and doing this. That it's life-changing. They have more energy, better sleep. Their joint aches and pains are nearly gone. I've had a couple of people tell me that pain in their joints or knee, hands, they don't have pain anymore. The brain fog has lifted for a lot of people. I've heard a lot of people say that they have better concentration. They are very task-oriented now. They can, accomplish so much more in a day than they were able to do even 6 weeks ago. Of course, we talk about hot flashes and night sweats. I think there is a stigma with hormone-related therapy that it's just about hot flashes and night sweats, and honestly, that's not everybody. Of course, some people can check that box, and it is helpful for that, but it's so much more than that, so much more. Also, we've heard increased muscle strength. Those individuals that are going to the gym are, feeling pretty good. They're not as sore when they leave the gym. They can just, they just feel better doing it, and they have more of the energy and the drive and the motivation to get to the gym. And we've even had a couple of people that are going to the gym now twice a day. Of course, we talk about libido. That's something that a lot of individuals have also noted. And again, just overall feeling really, really good. Energized, good, like a cloud has been lifted.
And when we check your labs, we're not just checking your hormones, but we're doing a complete, we do a CBC, a BMP, we check your vitamin D level, your vitamin B12 level. I personally have been pelleted now twice, and it has been literally, I sleep through the night, I don't get up all night long to go to the restroom. My night sweats literally stopped in 2 weeks. My sleep, just the energy, the men that are coming in, their energy level is like 3 times better than it was. We had a guy that was like sleeping until noon, but his vitamin D level was also like in the tank. So we've given him vitamin D. We pelleted him, and he said it's just been the difference between night and day. We have people as young as in their 30s, and then we have some people that are 74 years old, and they're all, everybody's experiencing just literally life-changing experiences. So I cannot, just from personal experience, I can't speak highly enough about the pellets and just how wonderful they are. And then Lindsay's going to talk about too, just there's all these studies, and we actually have a book also that we can give you when you come in to read, and it goes over like all of the body systems, like your heart, how it helps our brain, how it helps our heart.
Yeah, and I think another thing is too, I know there are different availabilities as far as different modalities of how hormones are administered. I know there's injections, there's cream, there's suppository. I think these are some of the more common ones. The pellets, a different delivery system. These are based off of cardiac output, so you get more of a steady stream versus kind of those peaks and valleys that you may get with some of these creams and injectables that have a shorter half-life, that you need to administer maybe multiple times a week, a day, maybe twice a day. That it's more of a, I guess, steady delivery system, maybe a more reliable delivery system than some of the other modalities of hormone replacement. And just to kind of talk about too, like short-term benefits of this, again, is pretty much everything Ashley just hit on, as far as the better mood, better sleep, all of these things. Those are going to kind of be the things that you'll notice in the short term. As far as long-term benefits go, there's a lot of research and study being done, specifically on how, hormones affect our overall health. And so we're kind of talking more about long-term things as far as, improvement in bone density, decreased risk of cardiovascular disease. Now there's even some ongoing research in regards to Alzheimer's disease and how this may help to be a preventative thing for that. Also for rheumatoid arthritis, osteoarthritis, they're seeing this working really, really well for some of those patients. Also metabolic syndrome and macular degeneration. So those are a couple of the other ones that are being, watched at the moment.
But they're made from plants, so they're made from yams actually, so they're not synthetic. I think maybe we should touch on, there's a lot of stigma sometimes about what people think, like, oh, this is going to cause cancer.
Yeah.
So I'm going to let Lindsay come in.
The cancer aspect of this is very near and dear to my heart. I've done oncology for 11 plus years. If you would have asked me or presented this to me a year ago, I would have said, I really need to look into that, just coming from my background of being a nurse practitioner in oncology for a long time. I now understand this better as far as the bioidentical hormones go, that those individuals, there was a giant study called the Women's Health Initiative. Again, we have a book. I won't go into all of the detail. It's a huge study. There's a lot of detail with it. But essentially, this is kind of when hormone replacement therapy got a bad rap back in the, say probably late 90s, and don't quote me on that entirely, but I'd say probably late 90s, where they had noticed that in one arm of the study, individuals were having a higher risk of having DVTs, which are blood clots, pulmonary embolism, increased risk of stroke, as well as some cancer, particularly breast cancer. What they had discovered ultimately after this study has went on over an additional 10 plus years now, closer to 15, is that these were more related with synthetic hormones, these complications with synthetic hormones, particularly some of the synthetic estrogens, but mainly the synthetic progesterones that were the culprit with this. So, with that is a common question. Of course, we go over everyone's family history with a fine-tooth comb when you come in for your consultation. These treatments are specialized to you, and it's individualized to you. So again, if this is anything that is grabbing your attention, or if there's anything that you know, kind of perked up at when you heard, I think that this would be a really, really good option potentially for you. Or just coming in and, you know, even getting your blood levels checked, and then just kind of seeing what that entails, and then what's next for you.
So you can make an appointment online for a free consultation. You can call the store or you can walk in. We're here Tuesdays through Saturdays. Wednesdays we're here until 6. Saturdays we're here 9 to noon, and Tuesday, Thursday, and Friday we're here from 9 to 3. So it's been a pleasure, and we hope to see you soon.